Thank you all for joining us this morning, and I'm really looking forward again to this next session around how we protect vulnerable patients from sexual abuse in mental health hospitals. We're going to start with Tom Bell, and Tom is an author and consultant. He's going to talk about his sister's experiences. Then, for those of you who've been with us at the last session, we've then got Dr. Julie McGarry, who's going to speak virtually, but I think will be able to join us for the panel discussion. And she's the lead for domestic abuse and sexual safety at Nottinghamshire Healthcare NHS Foundation Trust. And then I'm delighted that Emma Furlong is with us in the room. And Emma is the sexual safety lead in forensics and independent sexual violence advisor at East London NHS Foundation Trust. So there's a wealth of experience. So, Tom, over to you.
The tragedy that has enveloped my family for 30 years is not the result of a single large, significant incident, one egregious act. It is the collective result of many individual small deeds and choices. I value authenticity. The guy in the bottom left, that's the LinkedIn me. That's the me, with the MBA or Master of Bugger All, as I call it, and the MSc, and 20 years as a chartered marketer. The guy in the bottom right is actually probably got more in common with me now, although I couldn't do that with my hair anymore, I have to say. In 2017, I was hounded out of the NHS. I spent 5 years in a middle management role in a community and mental health services trust, and I was forced to whistleblow as some unsafe practices emerged. The irony is I was working in the same mental health trust 30 years after what had happened to my sister, and I can tell you that we are all tempted, aren't we, to think that we live in a more enlightened era. I think in some respects we do. But things can and do happen and still happen. And the culture within the trust that I was working in 2017 seemed not that different to reports of the culture of the trust that my sister had been abused in 1988. Willful blindness, it seems like a fairly innocuous phrase, doesn't it? But small acts of willful blindness lead to these things. The suicide of a family member is like a grenade going off in your head. There's nothing that can prepare you for it. It tears through a family. At the point that Alison took her life, we had no idea that she'd been abused. We had no idea of what had gone on. And so we turned on each other as a family. I turned on my father. My sister turned on my mother. And some of the things that were said and the impacts of what happened there are irreparable. Blame grows. It just manifests in the absence of information and truth. And what we didn't know is that there were lots of people hiding lots of things at that point in time. So that is Alison. And she was... I'm the youngest of three. Alison was the middle child. She was brighter than me by a country mile. I would never have admitted that to her when I was younger, of course. And we used to fight like cat and dog. She was the sort of clever cat, and I was the fairly thick dog. Terrific, talented, and troubled. That was Alison. She was incredibly academically gifted, but also incredibly troubled. The coroner at the original inquest recorded an open verdict. At the time, I think things have changed now, but at the time, unless somebody had left a very explicit suicide note, the coroner couldn't record a verdict of suicide because committing suicide was seen for many years as a crime. It hasn't been that for a long time, but the idea was that the evidence test that had to be applied was the same as in a criminal court. So unless it was absolutely definite that someone had taken their own life, the coroner couldn't record that. Even though Alison clearly stepped in front of a train to take her own life, the coroner had to record an open verdict. But these were things the coroner didn't know at the time. She was 21 when she was first admitted, sectioned in 1987. She was taken advantage of, and that's a really polite way of saying abused, isn't it, by an older trainee nurse he was 35 years old. And one of the people who signed the forms authorising that termination was the consultant psychiatrist treating her. That was omitted from her medical records. So that level of collusion, if you like, is quite staggering. There's a but you can feel coming. I'm not for a second going to stand here and say that I understand how somebody could do that. But I do understand people's need to belong. Our need to belong is a fairly primeval, it is a primeval thing actually. Our need to belong is incredibly strong. And where that need is threatened, if being ostracised from a group is the result of not keeping your mouth shut, then a lot of people will make the decision not to say anything. And that's really where willful blindness kicks in. That was a handwritten letter that she sent to the NHS. The successor, or the predecessor, to the CQC, something called the Health Improvement Commission, I believe, first investigated the hospital that Alison was in. They produced a report in November 2000 which talked about the cruel and degrading treatment that some elderly patients were exposed to. At the time, the regulator wondered why staff within the hospital didn't take that report seriously. They kind of just brushed it off. Storm in a teacup, they said. When you realise that what was going on in the hospital at the time was that there are numerous reports of patients being raped on the ward by staff, and that, and I say this having spoken to a former employee, and these are their words, I'll quote them, having sex with patients was viewed by some staff as a perk of the job. You can understand why they would see a report that just talked about cruel and degrading treatment as kind of nothing, because actually what was going on behind that was much worse. And I have a theory about the Care Quality Commission. It's not particularly flattering one, I have to say, but some of you may have heard the joke about the person that comes home late at night, fairly drunk, and loses their keys, and they're looking for their keys underneath this streetlight. And somebody comes along after about 10 minutes has passed and offers to help them. And again, they're both wandering around. After another 10 minutes have passed, still no keys. And the person that stopped to help says to the drunk person, "Are you sure you dropped your keys here?" And the person turns around and says, "Well, no, I'm not, but everywhere else was dark, so I thought I'd look under the light." The CQC are kind of like that person. They look in the places that they always look for the things they expect to find. And I think sometimes their inability to lift the carpet and get a bit deeper underneath the issues and the culture inside organisations is a great concern. I think that should be a concern to us all. This is not a criticism of nurses. This is just an observation about us, who we are. Things will go wrong. Things do go wrong. That's us. We're complicated. If the human brain were simple enough to understand, we would be too simple to understand it. My gran was a nurse, a matron. My auntie was a health visitor. My mum was a nurse. And with my 5 years of middle management experience between us, I think there's about 100 years of NHS experience there. I think the NHS as a concept is the most incredible thing that we have. In fact, if an alien landed and said, define civilization, you would take them to the NHS and you'd say, this is a definition of civilization. This is our collective responsibility for each other. But we shouldn't kid ourselves. Not everybody in there is an angel. The NHS employs over 1 million people, right? So if you took a city of 1 million people and you applied Office of National Statistics crime statistics to that city, you'd have approximately 2,000 crimes reported. That's not committed, by the way, because we all know the more gets done than gets reported. But you'd have 2,000 crimes reported each week. My point is, they would include everything. In fact, there'd be according to ONS stats, there'd be 11.7 murders every year within that city of 1 million. So the NHS is a mirror of society. The people that work in the NHS are no more angelic or demonic than everybody else, but they're a mirror of society. So let's expect things to happen, because they will happen, because we're human. And that's how human we are, yeah? It's a combination of mine and Banksy's work. He obviously did the cool bit. We're going to drop our bananas at some point. Some of us will even pinch somebody else's, and worse. But it's what we do next that defines us, isn't it? That's what separates us. The Dalai Lama talks about the thing that separates us from the animal kingdom is choice. It's about what we do next. That's us. That's in our DNA, folks. That's who we are. In all our quest, fight, whatever you want to call it, for justice, we have always sought restorative justice. We never sought, sure, I've had the nightmares and the dreams about meeting the guy that did what he did down a dark alley with a piece of 4x2, but that isn't the way forward, is it? I've been through the anger barrier. I've been on the edge of suicide from the experiences that I've been through. Forgiveness is not mutually incompatible with accountability. And let's not mistake that, but let's acknowledge our humanity. Some of what we see happening in hospitals, if we saw it anywhere else, we wouldn't tolerate it. Between 400 and 1,100 deaths at Midstaff's Hospital as an estimate. Yeah. If 400 separate deaths had occurred in 400 different locations because of the poor care that somebody was being given in a personal house or a home, there would have been 400 prosecutions, more than likely. There wasn't a single prosecution because of what happened at Midstaff's. There's something kind of crazy going on there, isn't there? In 2017, the guy who did what he did to Alison finally admitted, under caution, to the police what he had done, that he had had sex on multiple occasions with Alison on hospital premises. That was the response of the Crown Prosecution Service when we met them. That is mind-blowing, that in 2018, in what we think is a post-Savile, sexually informed, aware era, that a senior prosecutor in the CPS thinks his only crime was having sex with someone in the wrong place. No issues, no thoughts of her vulnerability, no thoughts that she was in a mental health hospital because she needed protecting. So here's where we finish. The ingredients for abuse remain. We've got to acknowledge that. We've got to be just open and honest about that, because we're in human settings, yeah? Willful blindness prevails in many settings. The police still have a hands-off approach. I don't think there's any doubt about that for me. The Crown Prosecution Service lack the capacity and expertise required. So what can be done? Because it's all right me standing here twining, isn't it? What's the way forward? Culture change. Hey, that's simple, isn't it? Yeah, let's all do that, because that's really quick. But that's, we have to acknowledge culture change needs to happen. And everybody needs to understand that whatever happens in places can and might happen wherever you are. Developing just cultures. Some of you might be familiar with that, as in aviation, yeah? If you're not familiar with this concept, please look it up, and I'm happy to speak with you about it later. Research the impact and share the findings. The NHS and the wider system is absolutely terrible at understanding the impact of things and sharing those findings. There is no consistency amongst the CPS or amongst services of what the impact of these kind of things is on people, and system-wide training for staff, police, prosecutors and regulators. I'll shut up at this point.
Thank you, Tom. Thank you very much.
But the NHS is made up of these, is it 229 or 237, I can't remember now, different trusts, you know, all with their own visions and values and their own boards and this, that and the rest of it.
Yes.
And it's if it was a franchise, you'd call it the least consistent franchise in the world, wouldn't you? That's not a criticism, that's an observation, yeah? If you look at Cumbria, which is where I live and where what happened to Alison, a rural trust, an isolated trust, a trust that struggles to recruit, a trust where the same staff have been in place since 1066. So it's very situational specific. Now, put that, somebody that comes to work in Cumbria has lack of CPD, has lack of exposure. In fact, there's a report came out about child and adolescent mental health services in Cumbria a few years ago, which said the three teams under the same trust umbrella, one was north, one was west, one was south, hadn't spoken to each other for 3 years. Never mind spoken to another trust, never mind looked outside and said, what does good look like? They hadn't spoken to each other for 3 years. So you're getting a different service in Barrow-in-Furness than you were in Carlisle. So that probably wouldn't happen to that extent if you're in Newcastle-upon-Tyne or Liverpool or an East London Foundation Trust. You've got better critical mass, better access to professional networks. So when we talk about the NHS, I guess the context I'm trying to set in a very long-winded fashion is that it isn't one entity, and that one fix for Cumbria probably is totally different than the one for Nottingham and for London.
Indeed. No, absolutely, absolutely. And thank you for coming and talking to us about, Tom, about your own family's experience, Julie, about your service and the work you've done, and also to Emma about the work you've done at ELF. Can I ask you to give a warm thank you to all our speakers?